Hello, my name is Jennifer Barron. I'm a student at Gwinnett Technical College in the Clinical Research Program. Today I am presenting to you a research topic of interest. And so my research question was, why is there not proper screening of the millions of patients on serotonergic drugs for the elusive, underdiagnosed, and potentially fatal serotonin syndrome? There's many drugs prescribed today for other reasons other than depression that also increase serotonin levels, and this creates a dangerous scenario that many are completely unaware of. Okay, so what is serotonin and what is serotonin syndrome? So serotonin is a neurotransmitter and it acts as a hormone as well. It carries messages between our nerve cells and the brain and the central nervous system and throughout our entire body. Serotonin has several roles in the body, including influencing learning, memory, happiness, as well as regulating body temperature, sleep, sexual behavior, and hunger. Lack of enough serotonin is thought to play a major role in depression, anxiety, mania, and other health conditions. That's a quote from Cleveland Clinic. So serotonin syndrome, it's also known as SS, can manifest when there's too much serotonin in the nervous system. Now this is a potentially life-threatening, adverse drug reaction that can result from either therapeutic drug use, intentional self-poisoning, or inadvertent interaction between drugs. And that is my interest, the inadvertent interaction between drugs that many are unaware of, because there are drugs that increase your serotonin that are not antidepressants, that are other common types of medications like cough suppressants, for example. And when you mix a cough suppressant with an antidepressant, you could have serotonin syndrome, and sometimes the symptoms are so mild that even clinicians are completely unaware of this. So this here is a graphic, just a close-up of a synapse of a neuron or a nerve cell, and so neurotransmitters are presented in red, and it's how neurotransmitters are transported throughout the central nervous system. And so this is actually showing what very common antidepressant drug. It's called an SSRI, or selective serotonin reuptake inhibitor. It's the most common type of medication prescribed for depression, and this is really how it works. The drug blocks where the excess serotonin would be absorbed back up through the body, so then the extra serotonin is allowed to go throughout the nervous system. So that's really how a lot of antidepressants work. Now what are the symptoms of serotonin syndrome? So there's a huge range. So most people that know anything about serotonin syndrome know the extreme cases, but what my interest is the mild cases. So there's a huge spectrum of syndromes. So it can range from barely perceptible to lethal. Signs of excess serotonin can range. So symptoms are tremor and diarrhea in mild cases, to delirium, neuromuscular rigidity, and hypothermia or high temperatures in life-threatening cases. So it can be from a small tremor in the hand to completely stiff muscles and delirium. So the symptoms are described as a clinical triad. So there's three major things that make up the symptoms. So one is mental status change, two is autonomic hyperactivity, and three is neuromuscular abnormalities. Not all these symptoms will always be present. It's a dangerous situation. Clinicians often overlook the mild SS symptoms, and an inadvertent increase in the dose of the agent creating the serotonin syndrome, or the addition of a drug with another drug. So two drugs that both increase serotonin, that is one of the major causes of serotonin syndrome. So here's just a graphic of the continuum or the spectrum of symptoms, from the very mild to just, which is like could be a little hand tremor, to getting more severe with clonus, which is a repetitive jerking movement of the body that's uncontrollable. It's usually in the ankle. To the very high temperature, that's really when it's very dangerous. So it can be lethal. People have died from this. All right, so what does serotonin syndrome look like? So this poor lady, this is showing all the symptoms, how bad it can get. So diaphoresis is excess sweating, tachycardia, a high heart rate, agitation, increased bowel sounds, diarrhea, high blood pressure, clonus, like I said, the repetitive jerking of the extremities. So that's all listed there. Hyperreflexia is overactive reflexes. Agitation, that's just what, in extreme case, this person with all these symptoms would be close to death. And there's actually a very famous case of a girl, and her name was Libby Zion in 1984. She was put on a pretty strong antidepressant for stress, and she came down with a cold, I believe, earache, and she was put on a pain medication. So pain medications increase serotonin as well. And then she developed symptoms of a tremor and a high temperature. So she went to the emergency room. This was in 1984. Because of the high temperature, and I think she believed she had a tremor, they admitted her. Her temperature did not go down, so they gave her a strong pain medication. I think at like 4 in the morning, she all of a sudden became very confused and very agitated, very angry. So they gave her like an antipsychotic medication. Again, increases serotonin even more. And then they restrained her, which made her temperature rise, and she had died of cardiac arrest. So her name was Libby Zion. Her father took the hospital and the residents that treated her in the ER to court to try to sue. They believed that the residents were sleep deprived, because it used to be a rule that medical residents could work 36 hours in one altogether. So Libby's father believed that these residents were overtired, not overlooked by a physician, and didn't know what they were doing, basically. But really what happened was they prescribed her too many medications with serotonin, but at the time they didn't know that these drugs increased the serotonin. So she really died of serotonin syndrome, but it became this huge case. It took years to settle. There's actually a law in her name that now, to this day, medical residents can only work for 48 hours straight instead of the 36. But sadly, the serotonin syndrome was not brought to attention as to really what caused her death. It was more about the medical residents being sleep deprived. But that's a famous case. It was Libby Zion. One of my major concepts is that the mild type, these symptoms can be so minor that they're barely noticeable, but these should be screened for by clinicians if a patient is on serotonergic or drugs that increase serotonin. So like I said, the mild could be almost not noticeable. It could start with a little hand tremor. Diarrhea, you could listen to their bowel sounds, increased bowel sounds with a hand tremor. With somebody on an antidepressant should be a red flag, but that is not really how it works today. So there's something called the Hunter serotonin toxicity criteria. So this is what physicians and clinicians use in the emergency room. It's certain criteria, symptoms, and if certain criteria are met, it can be diagnosed as serotonin syndrome. And then the treatment is a medication that basically takes all the excess serotonin out of your system. So that is what we use today. It's called the Hunter serotonin toxicity criteria. So obviously there's a need for early recognition. Like I said, just a hand tremor and increased bowel sounds with somebody even on an antidepressant, pain medication should then further be looked into. So this is a quote from Prakash in 2019 that it's highly underdiagnosed clinical syndrome as up to 85% of physicians may not be even aware. The literature is biased for severe cases. The literature is sparse regarding clinical presentations in the evolution of SS and recognition of even mild. In the early stage is important as patients may develop life-threatening SS because of the inadvertent increase in the dose of a causative agent or the addition of another pro-serotonergic agent. So basically what he's saying is that it's so underdiagnosed because a lot of physicians aren't aware of the many other drugs, like I'll get into, that increase serotonin. And oftentimes serotonin syndrome happens because there's an addition of another drug for whatever reason when a patient is already on a drug that increases serotonin. So it's usually inadvertent, and that's what I'm talking about. There's a mild case that's inadvertent that even physicians aren't quite aware of. So my second point is that serotonergic drugs come in many forms, and it's not well known, like I said, and it's not just the common medications for antidepressants, what we think of that increases serotonin. So the SSRIs and the SNRIs are the most common drug prescribed for clinical depression. There's many of them. I think there's probably about 30 of them. Like I said, the most common meds prescribed. There's many drugs every year that come out, new types. It's one of the biggest pharmaceutical industries in the world. But the major point is there are other drugs that increase serotonin. So there's pain medications, and like that's a difficult situation. If somebody has chronic depression and chronic pain, it's most likely they're on 2 medications that increase serotonin. So that is something that needs to be watched. Other types of medications are sleep medications, appetite suppressors, cough medications, different herbal supplements, so even over-the-counter, stuff that are not even prescribed by the doctor. Muscle relaxers, all different things. Antibiotics, antifungals for fungal infections. So here's a list of different serotonergic drugs. They're summed up over there. Like I said, pain medications, anticonvulsants, anti-migraine drugs, antibiotics, and of course, illegal drugs. So LSD, ecstasy. That's another reason why the overdoses happen with these illegal drugs, because they may be on, say, a SSRI, they take ecstasy, and then they overdose. It's because of serotonin. A very common supplement called St. John's wort increases serotonin. So here's just a list of all of them. I listed a lot of them. My third point is that antidepressants are prescribed by many types of providers, not just psychiatrists. So in today's world, primary care physicians, internists, even OBGYNs prescribe antidepressants. So they're not as aware of interactions with other drugs. So there's been a reported increase in the incidence of SS because of this widespread use of SSRIs and other pro-serotonergic agents. So like I said, primary care providers treat many conditions that may require these medications. There's online drug interaction checkers that like pharmacists use and ER physicians use, but I think that those should be used for any drug that increases serotonin. So here's a list of just different conditions treated by probably a primary care doctor, and these patients ended up having serotonin syndrome. So you can see, of course, depression, because those are the main culprits, but everything from depression to carpal tunnel syndrome to epilepsy to a headache to an ankle sprain have resulted in serotonin syndrome, which can be lethal, and it does kill people every year. So my conclusions is just that serotonin syndrome is preventable, though it's on the rise. There's the mild form that's much more prevalent and it's underreported. And there needs to be greater acknowledgement that there are all these many different causes, like for example, the other drugs, not just the antidepressants, that increase serotonin. Like I said, it's the combination of medications that cause this serotonin syndrome. So studies need to be done that address this mild, elusive, chronic type serotonin syndrome. So that's my main interest, that there needs to be this higher awareness of this mild type, because it's actually very common. And if it's continued on for a long time, increased serotonin, if it's not fatal, it actually can cause like osteoporosis. It can cause like induced neurological disorders like Parkinson's disease. So it's actually very serious. It's a very serious problem, I think. And this is my whole research topic. I think that sums it up, and that's my conclusion. Is there any questions? Any questions? Okay, thank you very much. Oh, question, yes?
What really happened to Lily Zion?
What really happened to her?
Yes.
She died of cardiac arrest and respiratory failure because she was given too many medications that they weren't aware of at the time that increased her serotonin so high that that her heart went to cardiac arrest. But what came from it was that not the serotonin syndrome toxicity problem, but that residents are sleep deprived. That's what the court found, and so there's a law in New York, and I think it goes for all medical residents, that they can now only work 48 hours straight instead of 36. But it was the serotonin syndrome that killed Libby Zion. Thank you very much.